Okay. The room is filling quickly. We're just going to give people a few minutes to slowly come into our Zoom room here. We're also live streaming on YouTube. So if you're joining us from there, that's fantastic. Good to see you all on this Friday. Well, morning here for me on the West Coast, and afternoon and for all of our speakers actually, and then potentially evening, depending on where you are in the world. So I think I'm gonna get us started. We have a lot to cover today. So welcome everybody. I'm Dr. Deirdre Pickrell, the Dean of Student Success at Yorkville University and Toronto Film School. And on behalf of the Student Success team, I'm very pleased to welcome you to today's Ask an Expert session, our first for 2021. So this week, Toronto Film School and Yorkville University has been engaging with the conversation around Bill Let's Talk Day. It's important for our school communities to participate in the conversation because only together can we help end the stigma around mental health, whether that be in our schools, our communities, or our workplaces. This year's theme is now more than ever, every action counts. We are focusing on 4 areas that are included in this year's campaign: reach out, breathe, support, and be there. We have been sharing videos and tips and encouraging our community to join the conversation, all of that culminating in this special 1-hour Ask an Expert. Our goal here is to provide information and resources to our school community, working to ensure everyone knows they matter, their mental health matters, and that we are here. For the first time ever, our Ask an Expert is a panel. And so today I'm absolutely thrilled and honored to have this group here to talk to you. Our experts are Dr. Talia Singer, a registered nurse and psychotherapist practicing in Toronto, Ontario. She is a psychology instructor in the undergraduate program at Yorkville University. Dr. Singer will focus on reach out. And then we've got Alex Dews, a registered psychotherapist qualifying with specialized training and education in mindfulness, meditation, and human sexuality. Her area of focus for today is breathe. Then we've got Zach Schrader, a program advisor for Toronto Film School's film production program, with a clear mission of supporting students in their academic, personal, and professional lives. Zach's going to talk about support. And lastly, we've got Dr. Scott Friedman, a licensed psychologist and a diplomat in clinical psychology from the American Psychology, and focus on there. My role really join us along each of our. We're going to go for questions. Everybody uses the Q&A panel at the bottom of the screen, which are both that and. So with that, with no ado, Talia.
The audio is cutting in and out a little bit, but I think you said my name, so I'm just going to go for it with reach out. So I had some time to reflect on reaching out and why it's so hard to reach out, whether you're the one that's experiencing a mental health concern or whether you know someone or care for someone who's experiencing a mental health concern. And the first thought that came to my head is that, people who reach out, especially to me in my therapy practice, have been thinking about it for a very long time. And so reaching out is quite a long process. You first have to kind of identify that you need to reach out. And the second half of that is also feeling like you have the right to reach out, because we all engage in this kind of social comparison game where we say to ourselves, well, am I doing badly because, so-and-so is doing worse off than me. And so do I have the right to reach out, when I'm feeling badly? And to come to the conclusion that you do have the right to reach out often takes us to like some of the darkest times in our lives. It has to get pretty bad before we feel like we have the right to reach out. So that was the first thought that came to me. The second thing is that when you do decide to reach out, reaching out for help in the midst of something like depression, it's been described like running a marathon through water. And so there is this great heaviness that mental illness brings that makes any type of, proactive activity extremely hard to do. from the very simplest task of brushing your teeth to showering. And so picking up a phone and knowing who to call, when to reach out, it can feel like this invisible force just keeping you in place, making you feel like, you're running in the same place, or even just the heaviness of it can make it very difficult. And then the kind of hopelessness that's synonymous with feelings of depression are very incongruent with the actions of reaching out for help. It's kind of like this thinking trap, this logical fallacy loop that you fall into, that the very feeling of being hopeless is based on the depressed logic that no one can help. And it's very hard to break in order to reach out. But then let's say that you're able to kind of like shift this heaviness and want to reach out for help. There are additional barriers when you decide to reach out that might come into play. There's this kind of saying that there are no hard to reach clients, we just have hard to reach services. And where I'm located in Toronto, Ontario, that's especially true. Access to services can take a long time, and you have to kind of keep up the momentum or motivation to reach out over and over. So there's like this multi-step process. You might first have to reach out to your doctor. Your doctor might then have to make a referral. You might have to wait then in order to access whatever referral. You might have to make follow-up appointments, follow up for, certain types of treatments. The reach out activity happens again and again and again, and you have to have the stamina in order to reach out again and again and again. Because depression and anxiety and anything in between is a real mental energy suck. So think about how you're going to find the strength in order to keep up the activity of reaching out. There's also a lot of confusion when it comes to reaching out for services. So when you do have the thought, like, I should really reach out, do you know who to reach out to? How do you know whether you need somebody like a psychiatrist versus a clinical psychologist versus a psychotherapist versus just a social worker or a coach or anything? And so there's a lot of confusion in terminology and knowing which is the right service for you. Is it covered by your insurance? Are you going to be able to afford it? Is there a free service? Is the free service as good as the out-of-pocket service? And so there's a lot of questions about, what type of service is the right service for you. At Yorkville University, we're really lucky to have the mental health and wellness services that are free for students. It's all private and confidential, and there's a separation between academics and the mental health department. A lot of students sometimes are concerned that there's a link and people will know, but it's absolutely separate and private and confidential. And that goes for any type of mental health service. And then when I thought about reaching out some more, I also thought about the experience of minority and racialized communities and this added barrier to reaching out. So, if you do decide to reach out and you do think of who to talk to, will you be heard? Will you be understood? Will that person be able to identify with what you're going through? These are real questions that are barriers to reaching out. And then when we think in social care about hard to reach, we don't usually think about things like social marketing or awareness programs, whether people are represented in these kind of like big campaigns of like reaching out. So that's another thing to consider. And service shy populations may have had a history with not trusting supports for very good reasons. So therefore, it's really important to examine all our biases when we say reach out, because reaching out is like this layer cake of, thoughts and barriers to care. And then I also thought about reaching out on the side of someone who is offering support, because we really don't have that same schema or mental picture of what happens when someone has an emotional injury versus a physical injury. So we all have kind of like a picture of what we would do if you have a friend or a family member who's, let's say, broken their leg. So you see your friend or family member there with like a broken leg and you're like, stay right there. I'm going to call an ambulance. We're going to take you to the hospital. They're going to wrap it in, bandages. You're going to get a cast. And then in 6 to 8 weeks with a little Tylenol, you'll be okay. We don't have that same kind of schema for a psychological injury. It's so very subjective. The timelines are kind of arbitrary. It could involve a lot of different interventions and then a change to that intervention. So when we think about reaching out to someone who you definitely know needs support, we don't know what the picture of their recovery would look like. And then there's a lot of communication barriers when it comes to reaching out to someone with a mental health concern. If you say, "How are you doing?" and they say, "Fine," is that kind of the end of the conversation? You think to yourself, "Are you fine? Are you really fine? You don't look fine," And if they had a broken leg, you could say, "Look, you're not fine. It's broken. It's so visibly broken." But it's not the same with reaching out to someone who needs mental health support. But research shows that when people are suffering a mental health crisis, people in their life want to reach out even more so than when there's a physical injury. They just might not have the language or even the idea of how to follow up with the communication with someone who's suffering with a mental health concern. So the reach out part is so important. Asking, "Do you need help?" is often the first step in overcoming a communication barrier, but also reading up on what's next. Okay, so if you say, "Do you need help?" and they say yes, say, "Okay, I've looked this up. I know what to do. We can do this, we can do this. And with, I think the onset of COVID in the past year, there's been such an explosion and variety of services that it might be even more, there might be even more access and equity of service than there ever has been before. So I'm going to pass it back to Deirdre, Dr. Pickrell.
Thank you so much. That was brilliant. I almost wish we could pivot to questions, because I'm sure there's lots of things on people's minds, but we're gonna move on. I must stay in control of our conversation here. So
Always
thank you so much. Absolutely, Dr. Singer. Thanks so much. So we're now going to turn to Alex, who's going to talk about breathe. Alex, over to you.
Awesome. Hi, everyone. Thank you so much for including me in Yorkville University and Toronto Film School discussion for Bell Let's Talk. I'm very honored, very happy to be here. I am a Yorkville University graduate myself. I did the MACP program, and I'm currently a registered psychotherapist qualifying. Right now, I'm in private practice working with individuals with a wide range of mental health issues, and I specialize in mindfulness and meditation interventions. And today I'm here to talk to you about the breath. So the breath is an incredibly valuable gift and resource that we are all born with. It is our anchor to the present moment, and it connects us to our bodies. I really feel like mental health issues can't be properly explored or healed without considering the mind and body connection. Because we experience emotions in the body, whether that be sadness, anger, love, stress, panic, these feelings manifest in the body in different ways. For example, we may feel a tightness in our chest when we are sad, warmth in our heart when we feel love, or tension in our shoulders when we're stressed. By connecting with the breath, we can tune into these sensations and explore what feelings and sensations come up for us from a place of acceptance, non-judgment, and compassion. In order to heal, we need to acknowledge and embrace these feelings, even if they're distressing. Because the breath connects us to what is happening, tuning into the breath can amplify the intensity of our emotions. And here's where many of us tend to run. We fight, we reason with, we completely deny the reality of our experience, causing the feelings to be left unexplored and unprocessed, and left to manifest in other troubling or distressing ways. If instead we tune into the breath, while embracing these distressing feelings, we will notice that we can soothe these emotions while offering ourselves compassion. If we allow ourselves, to feel what our body calls us to feel, we can let go of suffering much faster and with greater ease. However, not all of us feel like we have the strength to do this alone, and that is perfectly normal. We aren't born necessarily knowing the best way to ease our suffering. We must learn this. And that's why a therapist or even a good friend who really listens with compassion can play a huge role in our ability to heal. We aren't meant to exist in isolation, and we also aren't meant to heal alone. The breath helps us ease the sensation of difficult emotions because it can reduce the experience of stress in the body. When we are experiencing anxiety or stress, for example, our fight and flight response is activated. We have stress hormones such as adrenaline and cortisol pumping through our bodies, and this can feel like your heart is racing. You have nausea, you have jitters, chest tightness, you experience just a general sense of panic, sweaty feelings, and tune into our breath, calms and soothes these symptoms. So by connecting the mind and body, be fully present in the here and the now. Through presence, we can be aware of our inner world and our outer world as they exist in this moment. This can be incredibly helpful for those experiencing anxiety and depression. Often those of us who are experiencing anxiety are very future-oriented, and we worry about what-if scenarios. And often those of us with depression tend to be oriented in the past. We ruminate, we stew over things that have happened. And in both experiences, the mind and body are not present or connected. The mind is lost in thought, and rarely is self-awareness and self-compassion present. The breath is then our key to the realm out of the past and out of the future. It is our invitation to connect to ourselves and the present, freeing us from fears about the future and what continues to haunt us from the past. In mindfulness and meditation, we are taught to have a non-judgmental and non-controlling relationship with the breath, our emotions, and our thoughts. We are simply taught to acknowledge our inhalations and our exhalations and notice where the breath shows up in our bodies. We are also taught to have the same relationship with our thoughts and our feelings. This simple practice of observation allows the breath to correct itself. It also allows thoughts to come and go, and it allows us to feel what we need to feel without adding further distress and suffering due to resistance. The breath truly is one of our greatest tools for maintaining health and wellness, and I hope this information was helpful for you today. So I invite you all to join me in a short breath awareness meditation. I totally respect if this is not for you, and please feel free to, spend this time a different way. But for the next 1 to 2 minutes, I just want you to kind of tune into the breath. You can close your eyes, you can keep them open, whatever you feel comfortable with. And I want you to maybe notice, is this the first time of the day where you've actually just kind of sat in stillness, sat with yourself? We tend to overlook this experience and we tend to just carry on with our responsibilities without taking the time to connect. So if you're into it, I invite you all to just close your eyes and just focus on your inhalations and exhalations as they come up, without extending judgment, without attempting to control the length, the intensity. Paying attention to where the breath shows up. Do you feel it in your nostrils? Do you feel it in your chest? Maybe your lower stomach? Wherever you feel it, it's perfectly normal. Your thoughts will carry you away. You'll definitely feel sensations that distract you from the breath, and that's okay. Just when you have that moment of awareness, bring yourself back to the breath. And when you're ready, just joining us back to the panel. So I hope you enjoyed that experience. And, normally sitting in that stillness and tuning into the breath for a little bit longer is, of course, going to be helpful. But I hope that was a nice little break for you, for your day. And thank you so much for including me in this conversation. I'll send it back to you, Deirdre.
Thanks so much, Alex. I think it's interesting when you stop to do that kind of exercise that sometimes you come to a realization that you tend to breathe quite shallow, and so
sure.
that paying more important to that breath and getting that oxygen in and calming your mind is so critical. We're going to talk about your podcast later, hopefully, if we have time. But for the moment, we're going to move on, and I'm going to turn it over to about support. Zach, over to you.
Can you hear me now?
Did we lose you, Zach?
Okay.
I can see you moving.
Well, I had microphone issues, but I think I'm good now. So thank you. My name's Zach. My pronouns are he and him. I am a program advisor in the film production program, as Deirdre said. I'm going to apologize in advance. Somebody has decided to jackhammer something outside of my building so I can hear it. So if you can too, apologies. Great timing. In my time, I've been with Toronto Film School for the past 6.5 years, and part of what I do is be supportive. And so Deirdre asked me to talk a little bit about what that means. And to me, it's kind of two things. One side is support as a noun, so a person or a place or a thing. And the other side is support as a verb, so doing and being supportive, being supportive, being a supportive person. So I think we can think of many of those nouns, those people, places, and things that are supportive. So this has been mentioned before, but counseling at TFS and YU is one of those big supportive resources. I cannot plug it enough. It's a great resource. So for all of you listening, that is definitely one of those services, those things that are supportive. And it extends to other things too, like places to go in your community. It can be safe spaces for people, community centers, awareness groups. These are great supportive resources for people. And I'm going to talk about being knowledgeable about those things too a bit later. We can think of many living beings that are supportive. We've heard of, support animals. A lot of people find those very effective. Supportive friends, colleagues. A lot of students talk about how supportive their instructors are. It goes beyond just teaching them stuff. It's about supporting them in learning more and blossoming into the careers. So those are supportive resources. There's phone numbers you can call. Crisis Services Canada is a great resource. I think we're all over Canada, so that's a good place to go. I'll put that in the chat a little bit later. And some examples are things like Hope for Wellness, which is for Indigenous folks across the country. We've all heard of Kids Help Phone, which is also a really great resource for people between the ages of 5 and 29. It's available 24 hours a day. So we've got these people, places, and things, and I'm sure people tuning in know of many more than that. There are so many more, and that kind of covers the noun side of things. But what I'm really interested in, and what I'm really quite passionate about, is support as a verb. So doing and being. And it's there's a lot of different parts to it, and a lot of it involve actions or words, ways of being that convey supportiveness. And for me, there's a few things, so I'm going to go through them, and maybe some of them will resonate with you. Acknowledgement is a really big one. So oftentimes people will come to you for support because they're struggling. It may be because they do have mental or physical health issues that they're struggling with. They may feel anxious or depressed in the moment. They may have had something shocking happen to them. And acknowledging is a really great supportive way that goes a long way. So if somebody comes to you and trusts you with this information, simply saying, I just want to acknowledge how brave it is to talk about your own anxiety. That's a very supportive statement. It doesn't. Am I back?
You're back.
Okay, perfect. Yeah. Thanks. And so saying, I just want to acknowledge how brave it is to talk about your own anxiety shows that you're there to listen, and it helps them understand how you feel about them too. And so it shows that you're attuned and aware of what they're saying, which is really important if you want to come across as being supportive. And it's a great way to convey acceptance. And a lot of people who want to talk often are scared of that. They're scared of not being accepted for how they're feeling. And so that's a great doing action. Another one is listening. And um, I think we all know this. We listen often with the intent to respond. So, we pick out the things that people are saying as they're talking and fashion a response in our minds while they speak. And, we might interrupt or overpower them in excitement to say these things. And that's not necessarily a bad thing. That's how conversation works. It's kind of a competition in a lot of ways, right? You want to say something, somebody else wants to say something. Um, and that shows engagement in what they're saying. It's a regular part of human interaction. Supportive listening, on the other hand, it's a little bit different, and it involves showing that you're listening. Firstly, with your nonverbals, so eye contact, looking attentive and interested in what the person is saying. That's difficult to do over Zoom, especially when your microphone keeps going in and out. But there are, in this age of Zoom, we've all learned ways of being supportive, screen to screen. You can tell when somebody's interested in what you're saying, even if you can just see their face. So that's an important part of it, is be aware of what you look like and what your body looks like while you're conveying supportiveness. And it's a good way to be in the moment, like nodding and saying yes, active listening types of things really help with that. Supportive listening also involves giving the people you're listening to the space and time to express themselves in the moment, and acknowledging the validity of what they're expressing and kind of mirroring it back to them. So, for example, this happens to me quite a bit. I'm sure people out listening can think of instances where this has happened. Somebody may talk to you about being stressed and depressed, and making eye contact, giving them the space to say the things they need to say, and then saying something like, that sounds really challenging, or it sounds like this means something really important to you. It's a great way to show that you're with them as they're talking. It's also a great way to convey empathy, which is another piece of being supportive. And when we talk about empathy, we think, the phrase walking a mile in someone's shoes, or working really hard to understand someone's perspective. And in many ways, I think that's correct. I think that's a great way to show it. And, we like to link our own experiences to conversations with people to show we understand. So, oh, I've been there. I've had something similar happen to me. And that can be a great way to show empathy in the right contexts, for sure. But it can also just mean, similar to supportive listening, echoing back what someone is saying in a compassionate way. So, like I said, that can be as basic as saying, it sounds like this is really meaningful to you. Or for example, if somebody's talking about stress in their family, you can say something like, you really love your family, don't you? It's clear that if they're stressed about their family, they really love them. And conveying that shows a really unique form of empathy, and it can make the person feel really supported just in the moment, and is a good way to show support. And another piece of this, the verbiage of being supported, is simply offering. You can offer. You can say, "Hey, I'm here to talk." I think a lot of us, I think Deirdre or Tally, you may have touched on this, but you can tell when somebody might need a little bit of support, especially if you're in class with them. We get to know our classmates a lot, our peers, our colleagues. You can just say, "I'm here to talk if you need it." And just offering that support, and also being knowledgeable. If somebody's talking to you about feeling out of place in an environment because maybe they've just disclosed that they're queer or something, knowing those nouns, those places people can go, and maybe offering to go with them is a great way to show support too. So we've got all these verbs happening, and another big verb when I think of support is patience. And oftentimes people who feel anxious or depressed or stressed, they can feel like they take up too much time with their issues, or they aren't worth the time. So people who feel this way tend to not really want to talk about it, because they're worried about the burden it will have on you. And being patient with that is being supportive. So that means not really having an agenda if you notice somebody's talking to you about things. So in my own context, for example, um, I'm sure everybody out there is a student. They understand the stress associated with being in school. And sometimes I'll have students talk to me. They'll say, I'm really stressed. And then they'll talk about something completely different. And it's not up to me to find out exactly what they're stressed about. Sometimes they may need to talk for a little while before they're comfortable actually digging into the thing that really is affecting them. And so sometimes just sitting back and being patient and just listening without an agenda is a great way to show that you support them. Sometimes that's all people need. I know I need it. I love to talk about my problems. And when people are patient with me, it really helps. It makes me feel supported. So um, sometimes it takes a while, and that's okay. Another verb is being knowledgeable about what's out there. And that kind of links into what I said earlier about, people, places, and things. Um, Mental illness might relate to real life problems in workplaces and schools, social life, relationships, and helping to support people you care about by knowing where they can go if they need help is really important. So many of you may know this. I've just sent you a chat. Crisis Services Canada is a really great database of all of these resources from all over the country that you can be knowledgeable about to be supportive. Another more, I think it's a more nuanced kind of approach to being supportive, a nuanced way to be supportive, is knowing when to lay off and be persistent. I think it makes people nervous sometimes, is, am I doing too much? Am I overdoing it? Am I not being supportive when I should? And it is tricky. It's hard. It involves almost a level of intuition sometimes, to know when it's too much or not enough. And oftentimes people will tell you if they don't want to talk about it, and that's okay too. People don't have to talk about it all the time. Um, but knowing that you're available is important. And sometimes being too persistent can, cause people to be a little bit cagey when it comes to, talking about what might be going on. Me, for example, I love being supportive, and this happens often with my friends. It happens with students sometimes. They're like, Zach, you need to calm down. Like, I'm okay, I'll let you know. And so then just them knowing that you're there is enough. And sometimes, being too ambitious or excited about it can be hard. And so knowing where that line exists is really important. Um, and the only exception, I think, is, and this is something that a lot of people are a little bit scared to talk about. It makes them a little bit nervous. But the exception, is if you think that somebody might be a harm to themselves or others, um, it's okay to be persistent and even take steps that you need to take to make sure that they're safe. Because being supportive at the end of the day is also about safety. And so knowing, if you know somebody is going to hurt themselves or someone else, you may have to call some of these numbers, like a mobile crisis unit or a paramedic. That is being supportive. And sometimes it's counterintuitive to do something that maybe somebody doesn't want you to do, or that feels strange, but it's always the right thing to do in those situations. So again, knowing when to lay off, knowing when to be persistent is key in the supportive thing. And so be mindful of the resources out there, because they will go a long way in helping you be supportive. And for all people tuning in from YU and TFS, there are resources here for supportive people. And if you want to learn more about this, I'm sure you can reach out to the mental health and wellness team if you want to know more information about this. Deirdre's nodding, of course. And I know particularly from my side at TFS, I'm always happy to talk about this. Our program advisors are always happy to talk about this. Being a supportive person involves being able to talk about it. So never be afraid to reach out if that's the case. The last thing that I kind of want to talk about is the concept of you can't be truly supportive if you're not feeling good. So self-care and taking care of yourself is really important. And self-care gets bounced around a lot. And I think a lot of people think it's about taking a break, spoiling yourselves, going to get that, that mani-pedi just to relax, which I fully endorse. Those things are great. But I think self-care goes deeper than that. And it means, to me at least, I don't know about anybody else, but to me, it means doing things that you don't necessarily enjoy in the moment, but that ensure that you will feel mentally and physically healthier later. So for me, it's like, meal prep, making sure that I don't have to deal with all of that later, or making sure my bed is made in the morning so that when I come home or when I go to bed, everything's ready for me. So it's being aware of how you look after yourself in the present so you're healthier later. And that's important. You can only be as supportive as you are mentally and physically healthy. So, and to me, that's one of the most important things, actually. It's okay to be a little bit selfish in that. So bear that in mind. So what happens when people feel supported? What happens? People typically tend to be more motivated. I've seen it happen many times in my life when people know that they're supported and they have somebody they know they can talk to when they're struggling. They're more motivated to go and achieve the things they really want to achieve. And that's really important. And they tend to be more resilient too. So they're more able to overcome these things that may have hindered them in the past. That supportiveness really does have a positive impact. So, and they know that you care because you've shown it in really special ways. So, so bear that in mind. Being supportive is very much a verb, and it's very much about what you say and what you do with them and yourself. And that's all.
Thanks so much, Zach. I'm
welcome.
amazed at the amount of verbs that you came up with for support. Like
I love verbs.
it was absolutely fantastic. But the kind of the before we head to Dr. Friedman, I think one of the important takeaways for me was know when you're listening to listen or you're listening to action, right?
Yes.
And there is that real difference there. I've seen some memes going around about before we have a conversation, am I listening to listen or am I listening to help you solve this problem? And let's negotiate that up front. And so that's because it was so often we're trying to find the solution to fix, but that's not actually what the person needed. They just needed somebody to listen.
I agree. And it can be uncomfortable because I think we like to do that. We like to be eager, especially me and everybody here, I'm sure, who are helpers. We like to jump in and do all we can, but sometimes it's just sitting back and letting things happen.
Yeah, exactly. That's where I think our breath comes in, right, Alex? Is just like just breathe, don't speak, just breathe. So this is great. Okay, I'm now going to turn it over to Dr. Friedman, and we're going to hear about the notion of be there. Dr. Friedman.
Thank you. I I just took my pre-discussion breath. So I appreciate very much being part of the panel. I'm the lead faculty for the practicum course for the MACP program. I'm going to focus on be there for one another in the mental health field, but I also want to extend this to anybody who's doing any kind of caregiving of other folks, whether it be friends, family members. So I'm going to talk a little bit about this from the mental health perspective. So in a book edited by Michael Sussman called A Perilous Calling, The Hazards of Psychotherapy Practice, he writes in the introduction, people do not become astronauts or firefighters without some appreciation of the dangers that they'll face. But such an informed decision is rare in the case of psychotherapists. He discusses that when we consistently deal with human trauma, how cruel people can be to one another, grief, loss, depression, and anxiety, therapists and other caregivers can experience at times a sense of despair and perhaps isolation. The client's symptoms, experiences, and human problems can certainly activate a helper's own emotional issues, as they can feel guilt and shame, perhaps about their own humanity. When I directed a mental health center on a college campus, I saw many graduate students who were in mental health professions. Almost all of them came in announcing their reason for being there. Basically, I'm not troubled by anything. I'm here for my training and learning. My response was always, of course. And then we took what was for them an unexpected journey together. And a goal was that both of us might be changed in some way. When I was in supervision during my training, some of my own issues, obsessionality, a wish for omnipotence, a desire to be seen as clever and admired, came to be seen by those who became mentors. And we explored how these issues and longings could interfere with the work of therapy that needed to occur. The personal issues and dilemmas of the therapist remind us that our role does not provide us with an immunity to struggles of one's own. When I supervise or teach students who work with people with severe mental illness, I talk with them that there is not us and them. Everything in mental health is on a continuum. And some people have an exaggerated form of the kinds of problems that many people, including those who are caregivers, face. So my real message here underneath a lot of this is to be there for your mental health colleagues and students, as we all have difficulties, and there can be a stigma, a belief that if one's problems are known, there will be judgment, such as, how can you be working in the mental health field or caring for others and have your own personal or emotional problems? Check on colleagues, have peer support groups, ask students how they're managing the rewards and stressors of training, as skills cannot be enhanced without making mistakes and learning from them. In the first practicum seminar that I do with the MACP students, and one of the things I discuss is an openness to learning and mistakes, many of them pour out how I intellectually know this, but it's really not emotionally acceptable because I like to be a perfectionist. And they tell me at the beginning of their training that they have imposter syndrome. And I say, you can't have imposter syndrome. We don't expect you to know a lot at this point. And for some of them, that's really a thing to think about. So be there so that those who work in mental health do not stigmatize mental health, destigmatize mental health for others, but really not for themselves. Thank you.
Thanks so much, Dr. Free. Especially important these days when there is not only do we have a mental health team at Yorkville University that needs to probably remember some of these things, but we know that there is an uptake in services, and there's lots of people that are reaching out looks, and we really need our caregivers in this field to also be taking out for their colleagues. Okay, I'm going to view here, and I'm going to open it up to questions. So we seem to have lost Zach. Hopefully that's on purpose, not just an internet problem. There you are, Zach.
Hi.
Yeah, no, we got you. So I would invite, I have to admit, I'm a little shocked. I thought we'd run over time. So kudos to our speakers for keeping it to their 10 minutes. And I would like to open it up to our community. We've got the chat, but if you can direct your questions in the Q&A, that would be fantastic. Now, while you were speaking, we did have one thing that came up in the Q&A, and while we're waiting for, I did respond to it, but while we're waiting for questions to come in, I thought I would send this out to our panel and see what you think. So over the last, 5, 10, 15 years, we're seeing a lot of language change. That, language that had meaning before that was negative, we're kind of doing away with those words. So this particular attendee noted that mental is perhaps no longer the appropriate word, that there has, for a long time, if you had a mental health problem, you were crazy. And so why is it that with moving towards, improved language to kind of get rid of language that has these meanings, why are we still using the term mental health? Any thoughts?
Well, I think that one, I mean, certainly when I use it, and sometimes I'll use emotional health, mental health. I think it's a good point. We do need to be thoughtful about language, just like in doing therapy, we need to be thoughtful about the words we say to people as well. But I guess for myself, I think still, using that kind of is part of trying to destigmatize it and to validate that people have these kinds of difficulties, like they have medical issues and they can have mental or emotional issues. But it is a good thing to discuss that it doesn't mean one is, quote, crazy or have a pejorative concept to it. It does acknowledge that there's a broad range and a continuum of these issues. And we certainly don't want to minimize the seriousness of some of this as well. So I think it's a great point, but I think it really is kind of part of the whole education and discussion process and the kind of conversation that's important to have.
Dr. Friedman, I agree with everything you said around the reclaiming of certain terms in order to destigmatize them. And, when I think about the term mental health, and I also think about the way in which, unfortunately, the medical community over a long period of time has really separated, emotional, psychological, mental health from the physical, and that we still tend to think of it as fairly separate when we know that there's so much that goes on. The head is part of the body. To treat one is to treat the rest. And so there's so many physical manifestations of emotional well-being or emotional ill health, that it's important to acknowledge that it is just, if you have a mental health condition, a mental health illness, that you have an illness, not unlike, as you said, diabetes, cardiovascular disease. It's all connected.
Yeah, when I went for a dental cleaning the other day, and they always ask, have you been flossing? But they know the answer to that, so they shouldn't be asking me this shaming question. They'd say, well, dental health is also related to your cardiovascular health. Do you know how important it is? And so I think that it is very, very important what you're saying, that the emotional, the mental, the physical, these are all things to kind of help educate people about how they're interconnected.
Absolutely. I agree with everything you guys said. I also think our spiritual health plays a huge role and is often overlooked or considered maybe taboo, or therapists aren't really inclined to go there. They don't want to offend, or, there are lots of reasons that contribute to that. But I think our spiritual health also plays a very fundamental role in our overall well-being.
I think there's a lot of, tying on to what you've said about destigmatizing words. I think there's a lot of, for a lot of people, there's pain associated with certain words. So mental is one of them. For me, I identify as queer. That's often, especially when I was younger, it was a word that meant something different than it means to me now. And I think there can be a lot of, important work that can be done in what that word means to you and how you destigmatize it. I think that's a big part of it, is instead of using something new, maybe, how do I come to a new awareness of what this word means and how I feel about it. So I always think that's a valuable conversation to have.
For sure. Thanks, everyone. It reminds me of some of the things that we're seeing, in the literature about mental health is health. So that, and I think, Dr. Singer, you're talking about that, is that why are we separating them? That we really should be coming together, because it is a system. It's our human system. And I want to say it's Corey Keyes, and I'd have to look, challenge me on it. He has this continuum of mental health where we actually all have mental health. And it's just, whether you have how your mental health is doing, you might have been not feeling well from a mental health perspective, but rather than having the separation that there are people that have mental illness and then there's everybody else, that we actually all have this notion of mental health. And some days some of us are doing better than others. Different, somebody that might have an illness.
Yeah,
Spectrum, but I think there's work being done around two concepts.
You cut out for a minute.
Are we
back?
Yeah.
So, well, Dr. Friedman, I think you were talking. Yeah.
Oh, yeah. It reminds me of somewhat of when one client who was depressed asked me, have you ever had a time where your mood was quite low? And in their case, the way I chose to respond, rather than be overly personal with them because of some other things, but my response was, who would want to talk to a therapist who couldn't understand human suffering? Mm-hmm. And so I think that it's a good point that, we all have mental health. And there are certain days where, the line between who's in which chair in the office can be a little thin. So that's an important point as well, I think.
Yeah, that's great. So we've got a couple of questions that are come in, and we've still got some time. So one attendee is asking, what is one most helpful tip you can give for mental health? That's what I'll leave it to decide to interpret. Somebody must have a tip. Come on.
I have a tip. I'm very self-conscious because I've already had some tech issues, but I didn't hear anything you said, Deirdre, and I don't know if it's me or you. So I'm good. I don't know. I'm going to assume that you're asking about the first one, tip about mental health. Okay. Yeah. I think my tip is, that's really broad, but I think my tip is what I touched on at the end, is looking after yourself. I think doing things that may not seem, setting yourself up for success. That's what I'm trying to say, is make sure that you're ready to go. And so that might mean, having a bedtime, especially during this pandemic. I work from home. It's very difficult to have a routine. So to me, that's really important, is making sure you're set up for success so you can be supportive.
I think one tip that I would say is to try to be mindful to not take everything you tell yourself about yourself as a complete fact.
I love that, Dr. Friedman. And I think that to build on that, my tip is, because the topic was reach out, is that when you come to those, I guess, incongruences about yourself, to give yourself the permission to go and talk to somebody about it, to not wait until, you know, you're at the lowest low, but that you are deserving of support and care and love and deep listening, just as you are. And you don't have to come in crawling on your hands and knees in agony.
Absolutely, I agree with Tally. I was going to say, yeah, we need to acknowledge that we're not meant to suffer in silence. We're not meant to suffer alone. Collective healing is so important, and I think it isn't emphasized enough that we need community to heal. We need community to feel connected and part of something greater than just ourselves.
That's great. It takes us back to Talia, what you were talking about earlier with the broken leg, right? We wouldn't hesitate. We wouldn't hesitate if we'd fallen and been in a car accident, had cancer, whatever it might be. But there's something about that when it's our brains, when it's that mental and psychological health that really has that pause. And that's hopefully what this conversation is doing today, is opening a door and encouraging people that this, we recognize the stigma does exist, but what we're all trying to do is really say it shouldn't. And there's something that everybody can do in order to help minimize that. So we've got, my internet has been terrible today. My apologies, everybody. But we've still got a couple of questions. And so if I cut out, Zach or somebody if they can look at the chat, the Q&A, that would be great. So another question has come in. Many of you have discussed listen to listen, not listen to take action. But how do you become self-aware that you are not truly listening to that person, but listening to respond? So how do you really know the kind of listening that you're doing?
I think
Zach, if you want to tackle that, or here we go.
No, I mean, just quickly, if as I'm listening and attending to what they're saying, if I have this impulse to quickly respond, I put the brakes on, and I remind myself I'll probably learn more about this if I let them talk, and so I have that. You know, I try and build in a delay.
I would second that too, and I think it's important to not put too much pressure on yourself either. I mean, we're human beings. We're meant to interact with each other and get excited about communicating. So do your best. Exactly what Dr. Friedman said. Do your best with that, and have that awareness. It's practice. It takes practice. Build that awareness.
Great, good, thanks. So we're getting some really good questions. What are some ways to motivate others to get help, as it's easier said than done?
I think typically we have an idea or a picture of exactly what we want someone to do when we think that they should get some help. And we have a definition that might not match that person's definition of what getting help is. And the same goes with the timeline. And so typically, like we talked about the broken leg, like I want to help you now. But with mental health, that it sometimes takes, it has its own timeline. It has a different timeline, and in all matters of offering support and receiving support and everything. So just being mindful of the fact that your definition, your timeline might be different.
I agree, Talia. I think when we try and force people to see that they need support, or force people to see things from a different perspective when they're not ready, it leads to resistance. You know, people might shut down. And I think just giving people the space to talk, to explore their own issues, and you just being there with them through that, I think is in and of itself healing enough. Maybe for that moment in time, and you know, they'll get there, hopefully.
So I think we've got time for one last question. What are the best ways to encourage individuals to continue reaching out over and over and not stop trying due to the frustration of the system? So our mental health system is perhaps not where we need it to be. So sometimes reaching out isn't, and asking for help isn't successful. How do we encourage people to keep trying to get the services that they need?
I personally talk about accessing services like being a Cinderella experience, that the shoe has to fit, and that if you try something and it's not the right fit for you, then to try something else. And even though it takes a lot of energy, mental energy and physical energy, that it has to be the right fit in order for it to be helpful.
Okay, well, we've come to the end of our time and my internet continues to be crappy, so it's probably time to say goodbye. To Dr. Singer, Dr. Friedman, Zach, Alex, thank you so much for being here today. I think this conversation was one that was important to have, and I think we learned a lot of valuable tips and strategies and given us lots to think about. I want to remind all of our Toronto Film School and Yorkville University community that we do have mental health supports available to students. They are free. We have videos and tip sheets. We have peer support groups, workshops, and of course, one-on-one counseling. So if you need help, please ask for it. You can email wellness@yorkvilleu.ca, and that email will get you to the Director of Mental Health, and she would be more than happy to provide you with the links to make a private and confidential appointment to see a counselor. And as Dr. Singer mentioned earlier, none of this is part of your academic record. So when you're ready, we are absolutely, let everybody know Ask an Expert is back for 2021. This year, we're going every other week rather than every week like we were last year. And so our next session will be Friday, February the 12th, when we are joined by Dr. Michael Sorsdahl. And he's going to come to talk about healthy relationships and consent. It is aligned to Sexual and Reproductive Health Awareness Week. So we really encourage you to tune back in there. In the meantime, fantastic today and talking with, and I hope to see you all back as experts this year. You'll hear from me. Bye, everybody. Take care.
Bye. Thanks.